Hi, this is Dr. Hashimoto here to talking about treating headaches with special types of x-rays. So one of the things that we do is upper cervical specific technique. Now most chiropractors and pretty much no medical doctors are going to be doing upper cervical specific techniques. And if you get an x-ray from somebody, you want to make sure that they have these special clamps right here. And what this clamp will do is it will actually hold your head in the exact right position to take an x-ray. That way, if there's a rotation of a vertebrae in a specific direction or a tilt of a vertebrae, we know that it's really tilted and it's not coming from you moving your head. It will also have a special piece right here where the x-ray comes, where we could line up the head to make sure it's pointed perfectly straight. And then what we're going to do is we're going to take 5 different x-rays of the top part of the neck, and then we're going to take some of maybe other parts of the area depending on what type of condition they have. So that is the analysis, and without proper analysis and diagnosis, you can't get those difficult migraines or headaches that you've had for 40 years to get better. I can't tell you how many patients I've had that have had headaches for 20 or 30 years, and they've been to chiropractors, physical therapists, medical doctors, medications, and this is what we had to do to get them better. That's what I have to say about x-ray. Alright, Dr. Hashimoto again. Here where we're talking about laser treatment, specific chiropractic treatment for the neck. So rather than just what most people will do is they're going to grab the vertebrae in the neck and they're going to just rotate it right or rotate it left. That's all they're going to do. And what we're going to do is we've looked at the specific misalignment of all the bones in the neck, and we're going to figure out the exact right direction. And when we're working on trigger points, one of the things we're going to actually use is this fine tip laser trigger point probe. So this is a laser specifically made for trigger points, and a lot of times they'll have little adhesions right here along the suboccipital muscles. And what I'm going to do is I could pinpoint on these areas, and the neat thing about this is I call it almost like a bingo diagnosis, because once I hit that trigger point there and the headache starts to improve, I know that's the exact right trigger point I need to work on. I'll also use special types of instruments. So this is an instrument that I've used in the past, and I've been taking special types of seminars, and I've actually had a special frequency imprinted into this device where I could click it, and this impulse is at 4.5 hertz, which is just the right frequency to move bones. I also have another device called our Sigma Ultraline, and then we have different types of heads, and then what we're going to do is we're going to specifically adjust the vertebrae in the neck to move it in the right direction. That's what we do for adjusting in laser when it comes to headaches. Another source of headaches is going to be coming from the jaw. We work with special types of dentists that do special types of splits. However, for actual jaw treatment, this is what we do. Number one, we're going to assess the jaw to make sure when the jaw opens, it opens straight up and down and not to the side like that, or it doesn't open and zigzag like that. So depending on what type of malposition and movement disorder it has will dictate what type of treatment we do on the jaw. And we don't do any manual adjusting on the jaw. We do vibration and impulse frequency treatment along the jaw on specific angles to restore proper movement. So that's how we treat the jaw, and we also do that along with laser.